Go.
Hello, my name is Q. I'll be your student nurse today. I just want to do a quick postpartum assessment on you. Is that okay?
Yes.
Okay. I want to verify that you are who you say you are. Can I have your name and date of birth?
Melissa Jeffrey,
Okay,
March 30th,
thank you. And the year?
1987.
Thank you so much. Okay, so what I'm going to examine is your breast starting off. I just want to ask you a few questions. Are you breastfeeding or formula feeding?
Breastfeeding.
Okay, that is great. Is everything going well so far?
Yes.
Oh, that is so good to hear. So I'm just going to look at your breast really quickly. What I'm going to take a look at when examining the patient's breast is we're going to take a look at the areola. When we're looking at the areola, we're trying to figure out if there's any redness or any tearing. That could indicate that the baby is not latching on properly, so we may need to intervene and help mom and baby, or show mom techniques on how she can help the baby latch on. But mom's areola is intact. It looks great. There is no redness, no swelling. I'll also kind of palpate and see whether or not the breasts are kind of firm. Her breast is not firm as of yet to indicate engorgement, because right now her breast is still coming in. But mom, what I do want to tell you is what you want to look out for is the colostrum. The colostrum is that rich gold milk. So we want to encourage you to let baby latch on as much as possible so that he or she can get that rich nutrients from that rich milk that only comes the first day or two. So after I assess mom's breast and I see that everything is good, we're then going to go down to the mom's uterus. Mom, if you can, oh, thank you. So her uterus is still fairly large, and that's to be expected. The further she goes into her postpartum days, the further the uterus will decline into her pelvic area. So in order to assess the uterus, what we want to do is use our dominant hand as the pressure point on her pelvic. That's kind of like the guard so that the uterus doesn't fall out. And then we'll kind of use the other hand on top of the uterus. And then what we'll kind of do is just put a tad bit pressure on the uterus until we feel that firm uterus. We want to make sure that we don't feel any boggy uterus. Boggy is kind of like soft and soggy. If it is soft, we don't want to move our hands from there because we want to prevent mom from hemorrhaging. So we're just going to press down on her uterus, and day by day that uterus will go down until it's in the pelvic area and no longer feelable. The next thing that I'll assess is going to be the bladder and the bowel. Mom, since you've been here, have you been able to urinate?
Yes.
Okay. Have you had a bowel movement?
Yes.
Okay, so mom is doing great. If she was to tell me that she was having issues with voiding or having a bowel movement, we would encourage her to walk or ambulate as much as possible. We would also encourage her to maybe perhaps sit on the toilet and run the water. That sensory sensation may get the pee going. And we also want to encourage her that considering that she just had a baby, she may be a little hesitant on pushing, but that it's normal to kind of feel a little bit pressure down there. But you do want to make sure you're voiding as to not accumulate urine in the bladder. We don't want your urine being full and uncomfortable. So after we assess the bowel and the bladder, the next thing we'll assess is going to be lochia. Lochia is the discharge that only postpartum moms get. So we want to either visually see mom's pad, or we want mom to explain what the color of that discharge is. We have 3 stages of lochia. It's rosha, which is the initial one, and alba, which is the last one. Mom will start with rosha, which is about 1 or 2 days. And then the secondary one is going to be kind of a light pink. That'll be like 3 to 4 days. And then maybe after we get home, we get in that alba stage. But we really want to see the color of that pad. We want to note the color of the discharge because that could also be indicative of any hemorrhaging. And we also want to see that the coloring and bleeding consistency is subsiding. We don't want to see any big clots. So we just want to see that it is turning from a lighter pink color to kind of fading away with minimum to no clots and no tissue in that pad. So after we examine the lochia, we're then going to examine the incisions. If mom has had a cesarean, we'll take a look at her incision, or if the doctor advised that she needed an episiotomy, which is no longer recommended. We're looking for, as we're looking at those incision sites, we're looking for redness, we're looking for edema, ecchymosis, discharge, or drainage, and approximation. So we want to make sure that the incision site is not spreading, that redness is not spreading. So we're looking at the measurements to make sure that these incisions, whether it is vaginally or cesarean, that is healing properly. So as we have looked at the incisions, we're now on Homensign, which is also no longer practiced anymore. But what I would do is I would come down to the mom and I would inspect her calves. I would feel them if they feel warm to the touch, or if she has any redness noted, or she says that there's pain down there. What we're doing is we're trying to inspect for blood clots. If the blood clot is noted, we want to encourage mom not to walk. But again, we're not practicing Homensign anymore as to not dislodge that clot. So mom's calves and legs look great. There's no indication of any blood clots. The next thing that we want to examine is mom's emotional status. And I've seen that mom is bonding with the baby. She's also asking me questions in regards to the proper way to latch, and when are the feedings time. So she's engaging with me and she's engaging with baby as well. So her emotional status appears to be in a good state. She doesn't appear to have any baby blues that could perhaps further progress to depression. And then the last one is Rogum, which we have not covered yet. So I want to thank y'all for looking at this video. Hopefully when you look at it, you'll see something that you learned new, or this will be a new review for you. Thank you.